Good afternoon, everyone. My name is Mary Beth Gauthier, and I work in the principal's office. It's my pleasure to be your host today for this online town hall for Queen's faculty and staff to discuss the fall campus reopening plan. In a moment, we'll be joined by Principal Patrick Deane, who, along with Dr. Kieran Moore, Medical Officer of Health for the Kingston, Frontenac, Lennox, and Addington Public Health Agency, we'll be answering as many of your questions as possible in the next hour. Also here today are Mark Green, Provost and Vice Principal Academic, Donna Janiak, Vice Principal of Finance and Administration, John Pierce, Vice Provost Teaching and Learning, Kim Woodhouse, Vice Principal Research, and David Walker, Special Advisor to the Principal for COVID-19. They'll all help answer questions with the Principal. Before we get started, I just would like to welcome Jan Hill, Associate Vice Principal, Indigenous Initiatives and Reconciliation, who will open our meeting today. Jan?
Thank you, Mary Beth. Greetings, everyone. Gunjokwa, Sawadahu Sios, Katnigari Wesa, De Chidawanu Harado, Ne Sungwayat Diso, Ne Wahi Rosa Anyo, Ne Gadi, Ohandu Gari Wadekwa, Ungadi Wanungode. Ona Sawadahu Sios, Gunjokwa, Ne Egadi, Ohandu Gari Wadekwa, Ungadi Wanungode. Agwego unska, Andido Atwait Nuni, Ne Ungwat Nigura, Dano Dea Tinuarado, Ne Agwego Yunki Yenawase, Gio and Jade. Agwego unska, Andido Atwait Nuni, Ne Ungwat Nigura, Dano Dea Tinuarado, Ne Agwego Yunki Yenawase, Jeet Karonyade. Dano Onagadi, Agwego, De Chidawanu Harado, Ne Sungwayat Disum. Togari, Nayotu, Nezewat Nigura. Today we give greetings and thanks that all the things on the earth and in the heavens continue to fulfill their responsibilities, even in the midst of all the challenges we are all facing. And by doing so, they make it possible for us to continue to exist as human beings. We acknowledge and give thanks to the Creator of all things and the energy of creation that this is so. We give thanks because even though we are faced with challenges in our lives, we were still given another day to draw breath and to see the beauty of creation. These instructions embrace my oral traditions passed down by my ancestors and revolve around our duty and responsibility to respect and live in harmony with each other and with everything that has been provided for our use in the natural world here on Mother Earth. And so now the words that come before all others have been said, and we can all focus on the reason that we have gathered here. Nyawat Giwahi, thank you for your kind attention.
Thank you, Jan. We've had a lot of questions come in today for today's event, as you can imagine, and we will try to get to as many of them as possible. We also have, I believe we've enabled the chat function for the Q&A function, but we may be having some difficulties with that today. However, please know that we've had hundreds of questions that have been submitted, so hopefully we'll hit some of your answers and we will try our best with the Q&A. Now I'd like to introduce Principal Patrick Deane, who will just kick us off with a few opening words. Patrick.
Thanks, Mary Beth. Hello, everybody. Thank you for joining us today. I think the important opportunity this provides is to get some answers to the questions all of you have. So I'm going to keep my remarks fairly brief. Besides welcoming everybody, I want to say thank you very much again to everybody for your extraordinary efforts over the last year and some months as we've negotiated our way through this COVID challenge. It's been very difficult for our whole community, and nevertheless, I think there's a lot to be proud of in what has been achieved. And of course, we now find ourselves at an interesting time when it's clear there is some light at the end of the tunnel. We're in the business of imagining what the fall could look like if the vaccine rollout goes as we expect it will. But this is a difficult thing to do because we're anticipating that kind of a fall, perhaps more promising, while we're still in the grip of some of the immediate challenges of COVID. So at this moment, as we have done throughout the pandemic, important for the university to stay very close to public health. And here I want to thank Dr. Moore for his generous ongoing advice and guidance to us over the whole course of the pandemic. We worked really closely with public health at every stage, and really important that was for the obvious reason that it hasn't been a straight linear course, as everybody knows, and almost the whole year has been spent making provisional decisions that had to be modified as circumstances changed, as the health circumstances changed. And we're still in that mode, thinking to the fall, making decisions based on the best advice and evidence that we have, but knowing that, as always, we will put the safety and health of our community first, and that decisions we make about what we're going to do in the fall may well have to be modified given the changing circumstances. So it was our hope today to provide you with some answers that are as clear as possible in the circumstances, and to give you a chance to hear from Dr. Moore about the situation and his expectations for the progress through the pandemic towards what we hope will be a return to something that looks like normal circumstances in the months to come. So Mary Beth, I'll leave it there, and we can move on to the presentation from Dr. Moore. You're on mute, Mary Beth. There you go.
I think we would learn about, I would have this down pat by now, but hopefully that's the only time that'll happen today. Dr. Moore, thank you so much for joining our town hall today. First off, I was just wondering if you could provide us with a short update on the current situation in KFL&A and about our current COVID cases and vaccine rollout, all those things. Thank you.
Sure. So I just have a brief PowerPoint to review, and I was trying to anticipate some questions you may have for me. So if we can get the PowerPoint up and running in presenter mode, that would be great. Thank you so much. And I would just like to echo the introduction by Dr. Patrick Deane. I think we've had a very strong and beneficial relationship with Queen's University over this last year. It's been a real pleasure working with the Faculty of Health Sciences and Dr. David Walker and trying to mitigate the effect of COVID-19 on our community, both at Queen's and in Kingston. And I think personally we've done a very good job relative to North America on limiting the effect and the spread of the virus. And I just have to once again thank everyone at Queen's. We've worked very closely with your students, with your residences, with your student health, having on-site testing, and I know at a personal level how difficult this has been for everyone on the line today, and want to thank you. We've sacrificed social and some mental and physical well-being, and certainly the communities had sacrificed on an economic vantage point as well during this last year. And I do see hope going forward. I do see a returning to a new normal post-pandemic. And I will now just present a couple of slides reviewing our current status and our hopes for the future. So next slide. And as an academic, I just have to disclose. I am an adjunct faculty at Queen's. I have research projects associated with Queen's. I am your local medical officer of health, so the family physician for this region. If you think of me as your population physician, I don't believe I have any other financial conflicts to raise to you. And again, want to thank Queen's for the relationship we've had that has protected both your community, your students, and the community at large. And next slide. So again, I'd just like to review where we are, where we're headed, and expectations, and just knowing that I don't have jurisdiction over your workplace, but we would want to continue the strong relationship we've had in providing guidance and support on testing, on immunization, outbreak management, if it's required at all. And thank you again for that relationship. Next slide. So It is now, and I just saw Troy Day's name on here. I'm humbled to be able to present any information in front of him, and he can correct me if I'm wrong, but I do believe SARS-CoV-2 will be with us for some time. It'll become an endemic winter virus, and we're going to have to learn to live with it over time. And we've developed over the last year significant partnerships and significant tools to be able to limit the spread of this virus in our community. And I think we've done very, very well together, both on case and contact management, on managing outbreaks, on limiting the spread into the community, and certain infection prevention and control measures that we've put in place in various workplaces. And now we can celebrate that we have highly effective vaccines that are safe, and the abundance of those vaccines is ever increasing. And I'll review some of that data as we've opened up the immunizations now to 12 and up across Ontario. I can celebrate some of our immunization rates locally. So the biggest change now, though, is we can have a strong prevention tool, and we will work with you to protect your workers as well as protect incoming students through making immunization accessible and available to your community. Next slide. We will be entering this fall much better prepared, better understanding of the virus, more knowledge, refined skill sets, and now with a powerful tool of immunization. I just want us all to recall that our initial goal going in to this pandemic was to minimize morbidity and mortality, protect the healthcare system, and minimize the unintended negative consequences of the pandemic. And that is the social, mental, physical, and economic well-being of our communities. And those aspects of our community have suffered the most. And I really feel very badly for students that haven't had the opportunity to benefit from the environment at Queen's by physically being present and participating in classes. And I think we can now anticipate that in the future with the new tool of immunization. If you had to tick the boxes, we've had one of the lowest mortality rates in North America. We've had the most minimal impact on the healthcare system, I think, with just a handful of people being admitted to the hospital from our region. And we've participated in Team Ontario. Our critical care services at one point had 50, 60 patients from outside of our region that they were providing care for. So I think locally we've done very well, and past performance is the best predictor of future performance. I think we can continue that strong partnership that we've had to limit the spread of this virus in our community. Now with immunization, our communities always embraced a very high immunization rate, some of the highest in Ontario for any of the vaccine preventable diseases. And I think the demand right now is far outstripping the supply, and we will have one of the highest immunization rates in the world, I anticipate, within our region. Next slide. Just for current status of cases, these are rates per 100,000 as of May 24th, and the Ontario average being 140, the Canadian average being around 136. You can see various public health measures have had to be put in play in Manitoba and Alberta. They're declining in Quebec, and we have a three-phased approach in Ontario. For perspective, today our rate in KFL&A is 7 per 100,000. And is declining and will continue to decline over the foreseeable future as more and more cases resolve. We had over 240 people tested at our assessment center yesterday, and we've had no positives from that population. I'm knocking on wood, but we're having difficulty finding the disease now in our community, despite a very robust testing strategy, one of the most robust in Ontario in terms of the percentage of the population that is tested on a daily basis. We're very aggressive in trying to find the virus and very aggressive in doing case and contact management, and that's been our success to date. Next slide. And you can look at various rates across the province. We have always been one of the safest areas in the province. Even being on the 401 between Toronto, Montreal, and Ottawa, we have done very well. We've had an asymptomatic testing strategy, a symptomatic testing strategy, and have made it accessible on campus, and will continue to work with your Student Wellness Centre to be able to provide that type of service in partnership also with Kingston Health Sciences Centre. So it's looking very positive for us to be and continue to be one of the lowest risk areas in the province. And next slide. And as you're seeing, our vaccine distribution across Ontario is rising dramatically and is getting to be one of the best in the world for first doses, with 8 million, over 8 million doses administered. In our region, we have over 60% of those over 16 years of age that have had their first doses, and are elderly, many of whom have had their second doses. So we're progressing brilliantly, I would say, in our immunization strategy with a multimodal approach, with fixed clinics, mobile clinics throughout our region, and we are using an equity lens locally to ensure that the most vulnerable are provided vaccine in an accessible and available way, and have many of our primary care partners and pharmacies participating. So we will continue that throughout, and certainly want to have your students and your faculty immunized with 2 doses before school starts, and that will be our goal. Quietly, I am working behind the scenes with the ministry, and I'm on the provincial task force to ensure that college and university eligible students and faculty are allowed 2 doses before the start, just like we're trying to accomplish for elementary and secondary schools. Next slide. And just the coverage rate for our region. This is from a few days ago, and it's progressing roughly a percentage point a day. Remarkable achievement by the community and by all partners, and to see those that are most vulnerable to this virus being the elderly. We have had a slow, steady decline or increase in coverage by age group, and we're moving slowly down this cascade as vaccine becomes more available, and we'll slowly see 12 and ups increasing percentage population coverage. As a reminder, for measles, mumps, rubella in this region, we've had 98-99% protection of our children, and I anticipate our community embracing a very, very high percentage immunization. In the States, they're somewhat frozen at 50 to 60%. In Israel, 50 to 60%, but I anticipate across Canada a much higher uptake and a much better protective level of our community, which will only enable us to get back to a post-pandemic, safer time frame sooner. And hopefully we all would want that to occur by the fall. Next slide. And this is just to give you some insight. We're in Ontario getting, this is for Pfizer alone, 1 million roughly doses heading forward per week. And that reflects roughly that in our area, we're getting approximately 15,000 doses per week. And none of those are staying in fridges. All of them are going in arms. There's a significant high demand for these vaccines. And sure, go to the next slide. And what we're aiming for, so this was, we have already achieved 60%. So if you draw the line over in the end of May, we're already at 60%. We anticipate being ahead of this schedule of heading towards 75-20. And that's a wonderful goal for all of us, because once you get that herd immunity, that community immunity, the incidence of the disease goes down significantly. And we're seeing that occur certainly here, but in the highest risk areas in the GTA, where the risk of infection is 10 times ours, their hospitalizations are coming down, and eventually the laggard indicators of ICU admission and ventilation will also come down, but it'll take weeks for that to occur. So if the key indicator to watch is hospital admissions, and that is coming down dramatically, and a very good signal for all of Ontario. And as you know, locally, we've had very, very few admissions to hospital and have been able to minimize the transmission in our community, which is different than in the GTA. Next slide. So this is a projection by the federal government as we build to the fall, and that's where we should be drawing our attention to, where I do believe we'll have low cases all summer long, and we'll have building immunity through natural, acquired immunity through immunization. It's anticipated at a federal level, they want around 75% of eligible individuals have received a full vaccine series, and we will then be able, because you're building community immunity, to be able to open up. And that certainly aligns well with Ontario's three-staged plan for reopening. By August, we should be allowing large groups to get together, outdoors and outdoor gatherings, as well as the beginning of indoor gatherings by August. I do think we'll move through those very quickly. The indicators that we're following are very, very positive. And in stage 3, there's indoor gatherings allowed, indoor dining allowed, and there will be a reduction in many of the public health measures. I think over the winter we'll still want to wear masks and have good hand hygiene. Because there are other respiratory viruses that will be mimicking that are naturally occurring. So in September, we have rhinovirus and then enterovirus and adenovirus. That's a natural seasonality, and then influenza over December and January. Those are just expected to come back. They were pretty well eliminated through public health measures this year with masking and hand hygiene, but we'll see the return of normal other viral pathogens in partnership with COVID. Next slide. And this is the three-phase plan we talked about. We're already at 60% immunization rate in many areas of Ontario, and including the GTA. They've been publicly acknowledging that major triumph in the GTA and Peel. And so we're ahead of the ball game, but these are the 3 stages. This starts on June 14th, 21 days. Then I do anticipate us heading into 70% immunity very quickly, and then the reopening in the phase 3 heading into mid-July to August. So you can see with the abundance of vaccines that are available, the second doses that will be available before September, I think we'll be shortening the 16-week time frame for second doses, given the increasing availability of vaccine that's between us. It really is looking cautiously optimistic for the fall. Certainly we'll want to be watching other variants. We'll have to continue to protect our borders about importation of new variants of concern, and monitoring the effectiveness of the vaccine. And your public health agencies will still be doing aggressive testing and case and contact management throughout the summer, and monitoring of strains within the community. Next slide. I do believe the Ministry of Colleges and Universities will be working with all post-secondary institutions to ensure that they have a response plan, and we're happy to review that in partnership with you. We again want to celebrate the great partnership with Dan Langham and all of the team that's working in the residences. That was a ton of work, but it paid off, and it was a very good and effective plan to limit the spread of the virus in residences and in our community. Next slide. And you may want to review this. This is a document from British Columbia. It basically adheres to the basic tenets of infection prevention control and masking and hand hygiene, and routine cleaning of high-touch surfaces, and preparing at least BC universities and colleges for the fall, and having an ongoing immunization strategy and a testing strategy. Next slide. And just to review, in the past year, this is the epidemic curve. Yes, we've had our peaks and troughs, but together we've been always able to limit the spread, and we never really had a major threat to the healthcare system and or to the community. We always had good case and contact management, and we called it playing whack-a-mole. Every time the virus tried to raise its head, we were able, through collective action of our community and case and contact management and aggressive testing, be able to limit the spread. Yes, we've had public measures put in play over the winter months of 2020 in 2021 and quite recently. But in effect, I don't think we absolutely needed them in KFL&A because we really did have good community that was willing to come forward and get tested and stay home if we were requested to be isolated and their high-risk contacts quarantined. So, and also for context, we have continued to have a great community coming forward for immunization. And I think the students that will be attending Queen's will have a high immunization rate as well. And we can help monitor that going into September as well. And certainly support student wellness being a partner in second doses or further first doses directly on campus if individuals have arrived without being immunized. And next slide. So that was just a quick overview of where we've been, where we're heading to. Cautious optimism for the fall, and I do anticipate being able to support Queen's University through all of those facets that we had in play already, but now with the new tool of immunization and hopefully being able to immunize well before students arrive, and also if they arrive without having had a first or second dose, we'll partner with you to ensure it's available very early on in late August or early September for further catch up and finalizing immunization strategy. And I can assure you that the amount of vaccine is going to be ever increasing within Canada and Ontario and now within KFL&A. Toronto and the GTA area took over half of the vaccines to do catch up and to try to get those hotspots under control. And now there's a more equal, regular distribution across Ontario. So locally, we'll be in a very, very good position heading into the fall. So I'll stop there and thank you for the opportunity to present.
Thank you very much, Dr. Moore. And thank you very much to you and your whole team for doing such a great job of playing whack-a-mole, as you said, and helping manage us through this. Just a few questions. You mentioned that you're on the provincial task force for vaccines and you're going to be advocating to have students get their second vaccine before classes begin in the fall. What about faculty and staff as well? Will they be part of that group, or will we have any pop-up vaccine clinics on campus?
Yeah, so I hope all faculty and staff have taken advantage of first doses as per the age groups, and now all of them are they can book online now. You can go to kflaph.ca and go to our vaccination site, and it will allow you to book as per criteria as well. VAX.com is our pharmacy website where you can, they're receiving roughly 4,000 doses of Pfizer plus additional doses of Moderna on a weekly basis now. So we really do have an abundance of vaccine going forward through June, July, and August. I would ask that all faculty take advantage. These vaccines are highly efficacious and safe, and the majority of them will be of the Moderna or Pfizer product, so the mRNA vaccines.
Okay. I've heard of a potential fourth wave. What could that look like with a population that's more vaccinated and has some more immunity towards the disease?
Yeah, so the possibility of a fourth wave is there, and it may be only able to occur once you have a high immunization rate if there's vaccine escape. And that's why we have to continue to monitor and be cautious globally, monitor for strains within Ontario, and continue to do case and contact management over the summer months to ensure that there's no fourth wave. We'll probably only see that occur where you have low immunization rates and in certain communities that would not want to get immunized. But as I was saying, in KFL&A, we have always, our community in general has always embraced immunization and have some of the highest immunization rates in Ontario. We're either number 1 or 2, not that I'm competitive, but I'm competitive, and have had great partnerships with our school boards to ensure we maintain the best protection through immunization. So I do think the risk of that for our jurisdiction is very, very low, and we'll have to be basically monitoring the large metropolitan areas for that risk.
Great. Thank you very much. Turning to Patrick, coming back to work on campus is a big change after working remotely for the past 14 months. At the very least, everyone's going to have to get out of their pajamas and yoga pants, and we'll have pet withdrawal in some cases as we get back into the office. Will we continue to allow some staff members to work from home if their circumstances require it, or if they find they're more productive working from home? Or are we looking at hybrid working arrangements?
Yeah, thanks, Mary Beth. It's a good and really important question. I've said often that the miracle we achieved back at the start of the pandemic of going remote as quickly as we did was a remarkable achievement. I think, in fact, in some ways, the return to work will be more challenging and complex psychologically, because I think it's been a difficult time for everybody for all the reasons Kieran spoke about. In a sense, the psychological and economic and social consequences have been pronounced, and they've been with us for a long time. So I do think everyone will have the best of intentions of finding their way back to normality, but it will be difficult. So the university will most definitely want to see the coming months as a transitional period in which individuals will transition back to work in ways that suit or are tailored to their circumstances. We certainly are committed to the notion of emerging from COVID with a more flexible approach to where people can work and what is required. So, for example, even in the longer term, individuals who do work that can actually very effectively be done from home should be able to continue to do that, so long as the actual expectations of the job can be satisfied. So in the long term, we'll put in place some remote worker agreements, and it'll be up to individual members of the workforce to talk to their dean or their supervisor about whether the work they do might make them eligible for such a thing. But I think the straightforward answer to your question is we recognize that even the transitional period will be challenging, and we'll do what we can to accommodate people's particular needs and concerns.
Great. We also had a lot of questions from faculty, and perhaps this is one I would direct to Mark Green, our provost. Will professors be required to support both remote and on-campus instruction at the same time for the same course, even after we're through the pandemic? Mark?
Yeah, thank you very much, Mary Beth. And certainly that has been an important. Yeah, thank you very much. That certainly has been an important topic and question. And our aim, based on our expectation of a highly vaccinated community for the fall, as Dr. Moore has already mentioned, is that most courses will be offered in person only, while some will be offered remotely to support progression for students and of course graduation. We have a really good memorandum of agreement with CUFA that describes the procedures, including additional additional teaching support, and also compensation if a faculty member does agree to teach a course simultaneously in both the remote and in-person modes. But we expect that will be a very small minority of the offering, and that most will be done in person and some offered in the solely remotely.
Thanks. Thank you for that. We've had a question come in the chat, and I'm just going to see if Dr. Moore could handle this one. So in stage 3, will we still have social distancing measures in place? And how would that work when we have some large classes here on campus?
So for stage or step 3, which is going to be happening in August, I just have it in front of me. Indoor gatherings with large capacity will have some limitations and some restrictions, but for the most part, what we've seen when we reviewed the BC statement is that classes can return in full. And that there will be measures put in place to screen, as we're traditionally always screening. We'll be encouraging immunization all along. If you're symptomatic with any respiratory illness, you'd be asked to stay home, potentially get tested. And when you can't have physical distancing, there'll probably be ongoing masking and hand hygiene in place. And I think that strategy will work very effectively, given that the risk will be exceptionally low for transmission once we've got even 70 to 80% of our community immunized. So for context, we have 60% of our community immunized in Kingston right now, and we can't find the virus. And I do think that's going to be happening in the fall. As long as we maintain a high immunization rate, we'll continue to test and try to find it, but it will be difficult to find. If we do find it, we'll do our typical public health measures that have worked well in the past. There'll be other viruses that will get people anxious because we'll be closer together and we'll be in closer spaces, but we'll be able to differentiate them through testing as well, just to give you situational awareness. No, it's not COVID, it's rhinovirus, which happens every September, or it's para-influenza virus that will make you have a barky cough. So we'll try to give you that situational awareness when it's not COVID, but it's this virus, just to allow you to know that we're getting back to the normal winter virus season. That's going to be a little anxiety provoking to people. But that's what we've lived with for millennia, of the normal pattern of viruses in winter. But now we've got a tool that protects us against severe disease and hospitalization through immunization. So we'll be in a much safer place going forward.
I could just ask a question about when do you think vaccines are going to be approved for younger children under 12?
Good question. So we're just reviewing the Moderna trials that did 12 and above, and then we'll be monitoring the data. I haven't seen any studies yet for children under 12. And it's important to recall that children under 10, the receptors that this virus binds to, they have many fewer receptors, and they really don't get ill under 10 from this virus. It would be very, very rare to have an serious adverse event from this virus. And so it's certainly not a priority because they don't have morbidity or mortality associated with them under 10 to immunize them. And it may be that they get natural immunity over time to this virus, which they do to all of the normal patterns. If you're a parent, your child's had a fever and a cold week after week after daycare and first a couple of grades of school, and that's how they'll get natural immunity to this virus and all the other normal respiratory viruses. Eventually, this will become endemic, and children will get natural immunity to it over time around the globe.
We have another question from the chat. Dr. Fauci in the US has suggested that the actual figure of percent of population fully vaccinated to achieve herd immunity is still uncertain. So where does the 75% of population immunized target come from, and how confident are you that achieving that target will protect Canadians, as we have a whole new variants of concern that can arise in the future? Big question.
Oh yeah, it was a really good question, and I'm embarrassed to even answer it with Troy Day listening. It is a mathematical calculation, and it's 1 minus 1 over R naught, and that's where they're getting it from. So if this virus normally spreads to 1 to 3 people, and the variants do spread differently, so that R naught will change. That calculates out to like a 70%, but then you need to include the effectiveness, and if it's not 100% effective vaccine, then you have to move that number up higher and higher. But what we're already seeing across the globe, where you have 60–70% of immunization rates, you're seeing the virus slow down dramatically. And I think we're at a population level in KFL&A, but also in Ontario, are going to have much higher rates than anywhere else in the globe. I just anticipate Canadians embracing prevention as we do, have a universal immunization program, which is very unique for the globe as well. So I do think 80 to 90 is probably going to be a sweet spot, and that'll be not only a mathematical calculation, but a lived experience that we'll watch around the globe to be able to monitor when the virus really slows down significantly.
I really like this optimism and these signs of bright lights that you're talking about. Any predictions on traveling between different countries and things like that? Like, we can be protected here in Canada, but we can only be as safe as other countries, right?
Oh, yes, a really good question. And I hope you're realizing I'm optimistic, but I'm cautiously optimistic. And we need to still have the testing and the variants of concern monitoring. And we need the federal government to continue a federal quarantine process and a federal testing for the introduction of new variants. That, to be honest, that hasn't been the most robust system, because clearly we've had all the variants globally come back into Canada very, very quickly. And that needs to be tightened up. And we need better early testing, and they are trying. I'm on a federal panel that's giving them advice to have whole genome sequencing within 7 days, rapid turnaround, and early identification of potential vaccine escape viruses. So international travel will still need, for the next year or so, a testing strategy, a quarantine strategy when you return for safeguarding Canadians, but it has to be more robust than it's been in the past.
Great. Thank you. I'm going to just hand it over to Patrick for a second. A number of people have asked about our spaces on campus and how we're going to manage providing proper ventilation and cleaning once everyone is back in the fall. Has there been any work underway or is planned to upgrade our ventilation and improve some air quality in our buildings?
Thanks, Mary Beth. It's a good question. I'm going to pass this one over to Donna, because I think she has some important information to impart on that.
Great, thank you, Patrick. So yes, a lot of work has been done across the university on cleaning, all of the high-touch surfaces and so on, and that will continue, obviously, in the fall, especially as we have more people on campus. That will be very important. So on the cleaning side, that will just continue what has been happening already. On the ventilation side, a lot of work has been done already as well in terms of replacing filters, increasing airflows, and we do flushes before and after use of buildings in terms of increasing airflows. And facilities right now is in the process of documenting every building and the ability to do, I know a lot of people are aware of what U of T has put out in terms of their ventilation standards. And we're on par with that, and so they've done nice infographics and so on. So we need to get there to communicate what we're doing, and so as well as the inventory of all buildings and those that are able to have the 6 air changes per hour, which is only in classrooms that U of T is doing it, and we believe that in most of our classrooms that is the case. And we're also looking to, because that's where the more people will be, and obviously in classrooms, we're also looking at purchasing, standalone units for those where we don't believe the airflow is what we'd like it to be. But we are doing a lot, and we will work on better public information on all of those measures that we have, so that we can then post them on the website.
Thanks, Donna. We have another question that's come in. I think I'm going to direct this one to Dr. Moore again. We're going to try to get as many students, of course, as we can vaccinated with 2 doses before September, but there could be a lot that aren't vaccinated when they come back in September. So how is that going to be safe to have on-campus teaching with no physical distancing if we have a large number of students who aren't vaccinated?
So returning students, we should have a safety process in play for them. We should be monitoring their symptoms We should be encouraging vaccination, and we should have testing on campus as we had in the fall and in January to be able to detect the virus and isolate those individuals if required. We will work with your student wellness to be able to provide first or second doses on campus, no matter where these individuals have had their first doses on the globe, and ensure that they're fully protected. Just as a reminder, first doses are significantly beneficial and efficacious, and the second dose gives them an extra booster. But the other piece that we all have to remind ourselves of is community immunity. That the higher the number of people immunized in a community, the less the virus can spread and the less risk it is to propagate. So if you're immunized, you're going to have a significant reduction in your risk of being hospitalized and or mortality associated with this vaccine and virus. And if we continue to build community immunity, we won't see this virus propagate rapidly. It just will not be able to accomplish its viral mission and spreading. So that is the tenet. Even if we don't have 10% of the population immunized in Canada, which we probably will end up with that proportion that won't want to be immunized, we will have a significant risk of reduction in the virus spreading, period. It won't have an ability. And that's all of our vaccine preventable diseases are using that same model. There's usually 5% that don't get the measles, mumps, rubella vaccine across Canada, and we don't see the virus propagate as a result. So I would not just look at individual risk, but look at the community risk, which will be significantly reduced through community immunity and all of us embracing primary prevention through immunization.
Thank you. Patrick, as we've talked about, this is going to be a big change to remove from our remote operations back to campus. What change management considerations are being made to help with this transition, to be compassionate to staff and their needs, and also to address any specific mental health resources or those needs that might be required as anxiety levels go up if people start getting together again with more people?
Yeah, thanks, Mary Beth. I'll make a start on this and then invite colleagues to jump in. I mean, I think we've come to where we have through the pandemic through a really remarkable effort of group support, and my hope is that we'll continue to work together to support each other through some of these difficulties as we wend our way out of the pandemic and into something that looks like normal life again. I think this is a highly decentralized organization. I think it's really important for wherever people are situated in the institution for them to be close to their supervisors, their deans, their directors, and to have an ongoing conversation about what might be required in this transition. I think we have to see it as a responsibility to the whole community to support each other in working through the psychological and other challenges. I mean, I know, for example, many families will face significant challenges returning to work or having members return to work after the pandemic period. So flexibility, as I said earlier on, is something we will want to show in our dealings with all members of our community. Now, there are formal supports, mental health supports, there's the employee assistance program and so on. So I might actually turn to Donna to talk a little bit about the HR supports that are available.
It's a great question, Mary Beth, and the fall planning working group that the memo that Mark and I sent out referenced. The initial meetings of that group were just gathered, and probably the stage that they're at right now was just gatherings everyone's questions and concerns, you know, that people were hearing from employees and so on, so that we would be prepared to deal with all of those questions and concerns. And change management was the biggest issue that came up in terms of the university needs to provide support to our employees to enable them to come back feeling safe. And so HR over the summer is preparing a number of change management materials to help us all in this transition back to the workplace, in whatever form that may take. As Patrick said, we are also working on remote work arrangements for staff, and so that if it's operationally feasible and meets all of the other requirements, it would be possible to have flexible arrangements and so on. And for some people that may just be a slow transition back to full-time on campus. For others it may be longer term, and so we're working on all of the supports for all of those things. But the anxiety and the change management to deal with that is front and center, and all of those questions are being addressed are being gathered so that we can come up with strategies to address them.
Thank you. Thank you. We are starting to run short on time. We've had a number of questions come in the chat that I think are just kind of, I'm hoping just kind of like rapid fire questions that I can direct to Dr. Moore, if that's okay. I'm just going to pull them up here. One is about AstraZeneca. What about second doses for AstraZeneca?
Oh, so please go to our website and/or ygkvax.com. Second doses of AstraZeneca for those that received their first dose between March 10th and 19th are available now. They'll be, I think, at the 10 to 12 week mark coming up very closely, and they're available through pharmacies and/or if you can't get a participating pharmacy where you've got your first dose, we'll be advertising drive-through clinics in partnership with pharmacies in the next couple of days. So stay tuned for if you're part of that cohort. Otherwise, there will be second dose available for AstraZeneca patients, first doses. We have, I think, ample supply going forward, which is a good news story. Also, there's science being reviewed about second doses. If you started with AstraZeneca and would like to finish with an mRNA vaccine, that science will be coming out fairly shortly. We've got good reports back, preliminary reports of good immunogenicity of that combination, which is very intriguing because you're getting good cell-based immunity and good antibody production from that combination of vaccines. So stay tuned, but if you want to stay AstraZeneca to AstraZeneca, that will be available in the very near future, and just visit our website, and we tweet this out on a regular basis as well.
Great. You talked about contact tracing and continuing to screen being very important. What about the requirement for a 2-week isolation if you leave the region or travel or have visitors from outside? Is that still going to be in effect, you believe, in a little while?
We'll have to just monitor how well Manitoba does and Alberta does in bringing their rates down. Those are high risk areas in the country right now, high, as you saw on that first map I showed. And I'd be cautious at the GTA right now. They still have rates that are 10 times ours or 20 times ours in Peel. And so I'd be cautious about returning from those areas and or having visitors from those areas at present. And please take advantage of getting immunized. But as Canada builds its immunization strategy, which is very, very robust with ample supply, all of Canada will remain safe, and traveling within Canada will remain safe, especially in August and afterwards. And it'll be international travel that'll be the risk. I do think our southern border will remain closed for a while yet. Going forward, and then there may be, the federal government hasn't completely declared whether there'll have to be a vaccine passport for some countries, and we'll have to monitor that news from the federal government.
Okay. And one last question. Even if people are vaccinated, they're still very concerned that they can carry the virus and spread it to others, particularly to their young children. How great do you think this risk is?
I think it's small, because as we get community immunity, there'll be, even with us swabbing asymptomatic individuals who have been high-risk contacts, we're not finding the virus. And there is a process or piece called sterile immunity, where with these mRNA and the Pfizer vaccines, you there is a significant reduction of you carrying a virus, even if it's a particle, a small amount of the virus, which is amazing, which just goes to show the effectiveness of these vaccines. So yes, some people who are vaccinated could carry a small amount of the virus, but majority are actually not able to carry the virus because you've got such good protection. So sterile immunity is something we're watching very closely, and I think it's because many people get sterile immunity that the transmission rate is dropping rapidly.
Thank you so much. We're starting to run short on time. I just want to say that all of these questions are being collected, and we will be sharing them with the Fall Operations Planning Group as well. I want to turn things over just to Patrick Deane, if you have any other final comments as we end our hour here.
Well, thanks, Mary Beth. I want to thank Dr. Moore very much for a great presentation, very encouraging, I must say. So thanks very much, Kieran, for that, and also for your leadership through the pandemic, which has been truly remarkable. And I know from talking to my colleagues from other institutions, not all universities have been blessed with the same degree of close cooperation with their medical officers of health. And I think to the extent that we've been able to weather the storm, it's been very much because of that close connection to you and to your staff. So thanks very much, Kieran, and thank you for the encouragement too in our planning for the fall. I think we're all going into the fall, you know, as you say, optimistic but also cautious. We need to be mindful of the need to maintain some of those basic public health protections, but at the same time, it certainly seems as if the future does look really promising for in-person study in the fall. And I know that overwhelmingly, the university community will welcome that return to normality. So thanks very much, Kieran. And I'll just reiterate my thanks to everybody for extraordinary commitments to keeping on with the mission of the university in the teeth of a major disruption to our social and health and economic fabric of a sort that none of us have ever experienced before. So thanks, Mary Beth.
Thank you. I just want to also let everyone know that this event's been recorded, and we're going to be sharing it on the principal's website later and his YouTube channel later this afternoon. We also hope that we'll be doing some more of these events again. I think it's great to share this information. Certainly appreciate everyone joining us today. And we will hopefully enjoy a much different summer than we've had over the past spring and winter. I'm now going to welcome back Jan Hill to officially close our meeting today. Thank you.
Thank you, Mary Beth. Kunjokwa sawadahun sios kani gariwesa te chidawanu harado ne sungoya diso ne wahi rosa año ne gari ne ohandu gariwadekwa ungawana hetstu. Ona sawadahun sios kunjokwa ne egadi ohandu gariwadekwa ungadi wanungode. Agwego unska andiro atwait nuni ne ungwa nigura dano de tinorado ne agwego yunki yenowase ji yowanjade. Agwego unska andiro atwait nuni ne ungwa nigura dano de tinorado ne agwego yunki yenowase ji karunhyade. Dana onagadi agwego te chiruanu horado ne sungwa diso. Togadi neotum ne zewa nigura. Thank you all for your kind attention, and thank you all for all of this amazing information today. It's so very much appreciated.
Thanks very much, Jan. Thanks, everybody.